Welcome back. You're watching Night Vision. Let's now go back to our reports on H1N1. Health officials have screened people at an apartment block where a 4-year-old boy died from H1N1 on Monday. 3 people in the block had tested positive for the virus.
More than 150 residents of Mayfair apartment were screened. The block has 106 apartments and many residents offered themselves to be examined. On the day 4-year-old Sanjay was diagnosed with H1N1, health authorities sent 7 samples from residents of the block and 3 of them tested positive.
In Valley, the concerned apartments, we sent samples, 7 samples we sent to the King Institute, Gindi. Out of 7, 3 positive. 2 children positive, 2 and 1 adult. 3 people got admitted now. The 3 people got admitted in CDS, Thandiarpet. Now they are taking treatment in CDS. In this apartment, we have given chemoprophylaxis on Saturday night. We have given 16 people. We have given chemoprophylaxis. Out of 16, 12 people are adult and 4 people children. We have given.
The residents of the apartment block have taken precautionary measures to stop the spread of the flu.
One thing, I think there is more panic than anything else. The government officials have been in constant touch with us. The local area health officers and all the other people are giving enough support. The people who are actually going to school from here, we have requested as far as possible not to go to the school so that we can actually prevent. Most of the people are still staying here, including all of our families.
Right now, there is nobody who has any of those symptoms which need to be worried about. The people who have had are already being treated. So, the situation, yes, we've gone through a tough time, but we hope that it will not last.
The other residents have so far not reported any sign of H1N1 and are following instructions given by the health department. In Chennai, with camera person Devraj, Minal Shah for NDTV Hindu.
We're now joined live by Dr C N Deivanayagam. He's a member of the key advisory group of experts to the Union Health Ministry. Dr. Deivanayagam, good evening and thank you very much. This is Jennifer Arul here. Now, the government is talking about screening school children. Do you think this is feasible? Do you think it's actually practical to do that?
H1N1 epidemic and a pandemic, according to WHO, has created enormous panic in India, which I think is totally unwarranted. This is a virus which is like no other virus in its category, and apparently is a new virus and is wrongly called swine flu. You don't get this in pigs, and this is a modified form of virus A of the influenza family. What do we do if there is a pandemic or an epidemic? Do we screen people in the entire state? Do you screen people in schools? All these have not been found useful or feasible across the world. So this need not be done now. What we need to do is to identify cases who have symptoms which could fit in with the symptoms of influenza, and identify those cases where you need to interfere because of the rapidity of the spread. Remember, the majority of people with influenza A get better with or without drugs. And one immediate warning to all the people, especially to the family practitioners, please do not use antibiotics if you have anyone suspected of a virus infection like influenza A. This antibiotic will interfere with the gut flora, which is an important defense against the virus. So I would say that this screening of the school children is not very helpful and is not necessary now.
Doctor, this is Saptarshi here. Then what do you think is a more tangible response that the government can come up with?
The government should be able to say, we have set up large number of laboratories who will identify suspected cases where there is doubt in the general practitioner or specialist mind. We should rope in the infectious disease specialists in the medical colleges, tell them to cooperate with the King Institute of Preventive Medicine and the CMC Vellore, and say 10 centers in the state are ready to test samples if you have any difficulty at all. The diagnosis of influenza should be made clinically. You should be able to say abrupt onset of fever, sore throat, headache, cough, and a feeling of malaise or weakness. It lasts a few hours or a few days. Then you say that we have facilities for testing and private labs may also be allowed to test.
So, having heard you say that, doctor, then it's a good thing that the government has now, let private laboratories and private hospitals actually do these tests, because it eases up, I suppose, the stress on the King Institute and the CMC at Vellore. Good way to be going, right?
Number one. Number two, the tests are very costly. Each PCR test costs between 3,000 to 4,000 rupees a piece. Now we need to use that very, very carefully, identify pockets of severe infection in localities and identify those cases who require immediate help. Very young children, very old people, diabetics, or those on chronic renal dialysis and so on. You look after them very carefully and make sure all the hospitals in the state are equipped with basic needs for testing and looking after life support systems. No antibiotics.
Doctor, we understand that you are talking about identifying different pockets of severe infection. After the death of the child, unfortunate death of this child, the government actually has not been able to, or rather the public health experts have not been able to even pinpoint as the source of infection.
Yes. The most important point that we should not forget is, this is not a local native virus. If you have the proven H1N1 case, it must have come from USA. This is a new virus. It has not been described so far in any other country initially, and sometime in April 2009, it was first described in Mexico-US border. So, if you have a local virus, it's a local variant of a seasonal influenza A. So, we need not in fact worry about this unduly, and we need to test those people who have symptoms. It is unlikely that this boy has infected others in the locality because he was immediately taken to the hospital. What we need to do is, you suspect a case, you tell them, stay at home, don't go to work. The government can, however, stop large gatherings of people where there is a suspected pocket around. We should not allow people to mingle so readily, because the infection is spread through the breath and the air that we exhale. So, we need to do that. One important point to remember is, the masks give you a sense of protection, but they do not protect. You must have very highly airtight mask. If it is not airtight, it is not right.
Well, we do understand, doctor, that the WHO had advised everyone to use N92 masks, but then like they are very expensive, and they have to be imported as well. Do the triple layer surgical mask, does it help?
No, not at all. They are certainly a total waste of everybody's time, but unfortunately they can give you a sense of false security, which is very dangerous.
All right, doctor. So thank you so much for joining us and giving us how to manage this disease. Thank you very much, doctor, for your time.